The clinical dashboard is a new way of bringing information to us, which brings together a whole variety of different types of information, the temporal, time-based information and clinical intervention and hopefully outcome information together in one screen. So we're hoping it's going to give us a better idea of our input in terms of improving the overall care that the patients receive from us. We anticipate the advantages of this system being able to bring information to us in a ready, easy to access form. So that means for patient care, we'll be able to get information straight away when we need it. I mean, what's different about this clinical dashboard is we've bridged the gap between the pre-hospital phase and the in-hospital phase. And of course, that's been a big challenge because we've had to access patient outcome data and patient intervention data from the acute hospitals. Sounds quite simple, but in our region alone, we've got 28 acute trusts. So in developing this system, we've had to look at an approach that's scalable and can work with lots of different providers. So this is a real first for us. So the advice I'd have for another ambulance trust when they're looking at implementing clinical dashboards, and particularly when we're thinking about getting information from the acute hospitals and other providers, is making sure that they've got the strategic level of support from the PCTs and the strategic health authorities to encourage the other providers to be part of the project. Because actually, what's a priority to us might not be a priority to them. So when we're developing the dashboard, we have to see what the advantages are for both organisations so that we all want to see it regularly. So what are the benefits of clinical dashboard? Well, for quite a long time, ambulance service has been measured on the time it takes from the 999 call to when you get to the patient. And whilst that's really important for members of the public, it's not necessarily representative of high quality clinical care. If you have a look at the dashboard, you can see we're measuring a number of factors, the interventions we're making pre-hospitally, linking that up with the outcomes in the hospital and the treatments in the hospital. And that's much more indicative of high quality clinical care and moves us absolutely in the right direction of measures which are focused on clinical quality rather than just a temporal measurement. A perfect example of the time versus quality agenda is stroke care. For stroke, a certain number of patients are going to be eligible to receive clot-busting treatment, thrombolysis, but that can only be delivered at this present time in hospital. So actually, if it took me an extra 10 seconds to get to the patient, but I turned up with the right resource, able to take the patient to the right place at the earliest opportunity, actually the clinical outcome could be better. So it's not necessarily better to be there quicker. And things like this are really important because they help us move towards that quality agenda, which is about a whole package of care, not just one element of the journey.